Good morning. Thank you guys so much for joining us in our next installation of Status Y webinar called COVID-19 in Broader Terms. We are joined with our friends at Seton Medical Center to discuss what COVID-19 looks like in Bell County, what that means, and all of those kind of things and all your burning questions. So if you have any questions throughout the webinar, drop them down in the comments and we'll do our best to discuss them. But I'm going to pass it along to Miss Rebecca Moon, who's on location. Rebecca?
Jasmine, thanks so much. So as you can see, Dr. Colvin and I were wearing our face masks. We went through a lot of testing when we first entered the hospital to make sure our temperature, all of the things were good. And we want to present a great program to you. So because of that, we are going to remove our mask, but we're going to keep a little bit of our social distance as much as possible because we feel like the message we're going to give you is super important. So joining me today is Dr. Colvin. Dr. Colvin, tell us what you do a little bit here at the hospital.
Absolutely. Hi, everybody. So I'm the medical director of the emergency department here and the chief of medicine here at Seton Medical Center of Harker Heights. I'm also the medical director of the fire department. Very much invested and love this community a great deal. I've been here since we've opened back in 2000.
Wow, great to know. Thanks so much for taking the time to talk with us today. The messaging is so important. So current data happening right now in Bell County. We hear different things. We hear stuff that's nationwide. We hear stuff that's statewide. Can you talk to us about what's happening right here in Bell County right now?
Absolutely. So right now we've tested over 25,000 people in Bell County, and we've had 1,200 of those patients test positive. That gives us a rate of about 4.7%. So that means that out of everyone that we've tested, that's the base rate of what we found to have a positive result on our test. I think what's important to keep in mind is as we look at that, we continue to try to increase our testing as time goes on so that we can identify those patients that are concerned about it or have some mild symptoms. I think one of the things that's tricky about COVID is many people can have it and they can transmit it and they don't even have symptoms. As a comparison, I've never had an asymptomatic flu positive patient in my career. And so COVID is very unique in that. And so when you have a known exposure or you feel like you've been in a high risk environment, even if you have mild or no symptoms, it's reasonable to seek out your primary care and local facilities for testing.
Very interesting. Thank you very much for that. So how can we help stop the spread? We know wearing masks is the #1 recommended thing. What else do you recommend?
You know, I think first and foremost, and I've been trying to share this with other people that I've worked with, organizations I belong to, don't panic. I think the one thing that's frustrated me most within the medical community across the country is fear. You don't need to fear COVID. You need to respect it. And that's a different line of thinking when you respect the disease entity. And so wear masks. Respect it. Don't fear it. Wash your hands. If everybody would wear masks and everybody would wash their hands, this would be a completely different process. And so a lot of what you're seeing now in the public and the debating that's going on with politicians is really about trying to get people to move that direction and how best to do that. And I think that's where people get kind of lost in confusion.
And that's a great point because even this morning, our own Mayor Jose Segarra, held a press conference at 8:30 in the courthouse where he is mandating the wearing of masks in a public space, in a commercial public space. So that's on businesses now to try to help enforce that. So businesses, we have some things for you if you're in that place where you're going to have to start enforcing those masks. We'll plug some links in the comments below so that we don't take up Dr. Cohen's time with that. But know that we're here to help you through that process. And the mayor's directive is really just to help us stop the spread, stop COVID-19 from continuing, and help us move on with what we need to do in life.
Absolutely. And again, for those of you kind of tuning in late, we've already had a lot of extensive screening before we could even enter the facility. I get screened and checked on regularly, checked our temperatures. And so in this forum right now, we're not wearing masks so that we can communicate clearly with all of you. But outside of these screening parameters and everything we just went through to enter the building, wear your mask. It's very easy to do.
Wear it when you go to the grocery store, when you go to Walmart, at work. I know I have an office where I can close the door if I choose to, but I have my own space. But when I get up to even go to the restroom, I make sure to put that on so that I'm keeping everybody around be safe as well.
Absolutely.
So let's also talk about if somebody thinks that they are exhibiting symptoms and they want to get tested, where can they go?
So one of the things that I always try to encourage is that if you have a primary care physician or access to a clinic, check with them first. One of the things that we're still experiencing is that we are heavily reliant on commercial labs to do a lot of the testing for us. And so depending on their volumes and the supplies of the reagents for their testing, all of the facilities in the community are susceptible to that. So things to keep in mind, call your primary care physician first. If they're having limited availability, urgent cares and emergency departments can also see you. But right now, you'll notice, and the mayor in Austin said the same thing a few days ago, we're shifting back towards testing people that have symptoms. We're not just doing routine testing for people that are concerned, especially for work clearance and things of those nature. We're trying to save these tests and these reagents for people that are actively ill.
That's very good to know. If somebody tests positive, the quarantine time is currently 14 days. And is there anything specifically that people can do medicine-wise or anything like that? Is there anything proactive that we can do besides?
I wish there was. I think the most important thing is avoidance. And I think that's what everyone in the healthcare community across the world is struggling. There's no magic pill, despite what has been tossed around quite a bit. There's no magic medicine. There are things that we are identifying daily and continuously in our routine management of patients with COVID that are showing some promise. But there's nothing collectively the community can do other than wear masks and wash your hands. Staying hydrated, getting good rest. Those things are always important regardless of what the infectious etiology may be. But again, wash your hands, wear masks.
Fantastic advice. Thank you so much, doctor. All right, now I've heard that some people might be delaying regular care. If they have other illnesses, they have other needs or concerns of why they need to visit the hospital or their primary care, and they're not doing that. Is that wise? What do you recommend?
That breaks my heart. It really does. Please don't do that. Your medical care, your emergencies, cancer, heart attack, strokes, diabetes, kidney failure, none of that is stopped just because COVID showed up. Please, if you're feeling ill, seek medical attention. If you're having symptoms of loss of speech or weakness or blurry vision, if you're having chest pain, shortness of breath, please come into the emergency department. Let us take good care of you. We will protect you when you enter our facility. We'll put a mask on you. All of the personnel here are screened daily, and we are all wearing masks as well. We're all doing everything we can to help you guys. But when you're sick, please come in. I've had to manage patients who unfortunately stayed at home while they were having a heart attack and while they were having a stroke, and they presented days later. And there's nothing you can do at that point in time, and so it's very disheartening. If you're sick, please come in. We'll protect you and take very good care of you as always.
Very good advice. And I can tell you, when I walked into the hospital, I had my mask on. I was greeted by, like, there was no option of where I needed to go. I knew exactly where to come. There were multiple people, all very well contained. They were asking me all the questions. Have any of these things happened? Once I gave them who I needed to speak with, what I was here for, and I went through all the proper checks, then they brought me, we're actually in a secluded room. I know you can't see our background, but the doors are shut. Nobody can get in here. There's one other person with us who's very far away. So again, I know we talked about the reason we took our masks off was so that we could communicate with you. I am so impressed with everything that Seton is doing to keep anybody who walks in safe. I would feel very comfortable as a person coming in. If I had just broken my arm or I needed some routine thing, I wouldn't think twice about it. Hopefully you would feel the same way, knowing some of the measures that they're taking to help keep us as a community safe. Doctor, anything else that you would like to share with us?
I think one of the most important things when something so significant like this has happened in society is be mindful and be hopeful, be compassionate, be kind, wear your mask, wash your hands, look out for others. As a country, we've overcome so much. We will do the same thing with this disease, and please just respect it. Don't live in fear, but just respect it.
Excellent. So I know we've been asking for questions. If you have questions specifically for Dr. Colvin that he can answer, please type those in the comments below. And we'll do our best to get to all of your questions or your concerns or anything that we can help with. At this point, Jasmine, I'm going to need your help. So can you tell us some of the questions that might be have arrived already that we can ask?
So we don't have any questions that are in the comments right now yet. I'm sure everyone's still typing them. But it might be kind of neat if you guys could talk a little bit more about what those symptoms are. I know that we've all heard them, but some of those symptoms that you may be having that you need to go check and get if you're tested, if you have COVID.
Absolutely. I think first and foremost, anything where you feel like you're coming down with symptoms of a flu-like illness, that's the first thing. That's the biggest warning sign. Body aches, muscle aches, fever, chills, those kinds of things. Something unique about COVID is that people are losing a sense of smell. It is temporary, but they're finding that in about a third of patients. And so if you wake up one day and you realize you can't smell your jalapenos, that's an early sign that something may be going on. I think weakness, fatigue, and then there's been a lot of subjective symptoms, loose stools, nausea, and symptoms along that nature, nasal congestion, sneezing. So it is broad. And again, keep in mind that a large percentage, in some studies estimating almost half of patients will have no symptoms. That's why it's been so tough to track and kind of confine this virus, because so many people can transmit it and not even have symptoms. If you are feeling symptoms, we recommend that you look first to the clinic as possible resources for testing if need be. But for the most part, if you have symptoms, we're assuming right now in the middle of this pandemic that you have it. And so then the best thing to do at that point is to self-quarantine. The most conservative measures are recommending 14 days. And then after that, if you're symptom-free, depending on your employer and different facilities, they may have a testing sequence they want you to clear first. Some of the tests that you may have heard about recently are antibody tests. When you come in to get tested here, we do what we call a PCR, and then we get a little swab that goes through your nose to the back of your throat. And a lot of people say it feels like it's tickling your brain. It is not comfortable, but it is very, very quick and is temporary. And that's what we're doing to see if we have evidence of the virus within your system. The antibodies is about the process of understanding what antibodies do. It lets us know that your body's been exposed, and then that your immune system has mounted a response to that exposure. And we don't need to get bogged down in the nerdiness and the science of it, but at the end of the day, we do have some new tests now that if you may have been exposed, but you never had symptoms, but maybe your employer's wanting to get testing, maybe you want to have testing because you have a sick family member at home, we can do some antibody tests. And after about 2 weeks, we should start generating antibodies that we can find.
That's very interesting. That's super
nerdy.
Yeah.
All the nerds out there like me who are appreciating that information right now. They're going, thank you.
Yeah.
I love that. That was going to be my next question, is if you could elaborate on the antibody test. So you suggest that if you feel that you have been exposed to it at some point or over it, to try to get tested to see if you've had it before. And can they do that at Seton? Can they come to you guys for it?
They can, and they can go to their clinic, they can go to urgent care, but we do provide antibody testing. And what I'm finding more now is people are, to step back for a minute, one of the things that's always important about wearing a mask, especially in the community, there's so many people right now that are struggling with their own illnesses and their own diseases that you don't know, and you can't tell by looking at them. They may have cancer. They may have just come back from a very, very difficult surgery. They may have an immune system problem that you'll never understand or be able to see on the outside. But we're trying to protect them. And so if what I've seen more than anything else, that people come in and they have someone in their family like that. Hey, my mom just got diagnosed with lymphoma. They've started her chemo, and now she's going to be staying with me while she's being taken care of at the hospital. I want to make sure. I want to make sure that I'm okay and I'm protecting her. And I think that's a beautiful thing to do. And I think that that's where I'm seeing the antibody testing becoming more helpful for people in the community. In the medical community, we're using it for a little bit different reasons as we're trying to identify and screen people. I think one of the things that's very important, and I did a video a while back on it, but One of the things I fear and I worry about right now is people inhibiting or discontinuing elective surgeries. I think what we experienced a couple of months ago, we saw the outcome of that, and there was a lot of people that suddenly had to put off their knee surgery, or their spine surgery, or their cancer surgery, or diagnostic procedures that still impact life, that still matter. And they had to shut all those down because there was a feeling that we need to free up resources and space in case we get hit with a large wave of COVID patients. That being said, I worry about that. And so we are still doing our procedures here, thankfully. I hope that doesn't change in Bell County. And we are testing people before they get their elective procedures. I think it's very important, not just for them, but for everybody in the facility. And when patients are tested and found to be negative, they go on and have their elective procedure.
Wow.
So you brought up a really good point really quick. Is there still plenty of space here at Seton if suddenly there was going to be a larger spike? Would you be able to have the hospital capacity to see
Absolutely.
COVID patients who did
Absolutely.
respirators? Yeah.
Absolutely. And it's very much real. I won't get into details because of HIPAA laws and whatnot, but I've taken care of a lot of active COVID patients recently. And thankfully, most of them have done very, very well. Some of them have been very sick. I'm very proud of our facility for how we've managed to care for them. We've helped many people with significant COVID illnesses end up in the ICU and get to go home. And I think that is a beautiful thing that we don't talk about enough right now in society. I would like to see more of an emphasis on the survivors. I want to celebrate those people that have run that marathon with COVID and won. And I think that's something that also generates hope for all of us. We need to keep them in our prayers. And we need to be mindful of them and celebrate them when they get to leave the hospital. That's always a very good day for them.
Well, I love that. Let's celebrate hope. That's fantastic. So just to recap what we talked about today, current data, things are up a little bit, but there is still a 4.72 positivity rating. So we're still under control. The hospitals have us covered for people. There's testing and options available. We can stop the spread best by wearing your mask, which we both wore in here and will wear out as soon as this video is over. Make sure you're washing your hands for the appropriate time with soap and water. Again, the mayor of Killeen just issued the order that we need to definitely in commercial places when we're out and about wear those masks. So please help us follow that order and help the businesses maintain what they need to do to stay open. If you need to get tested, go to your local provider. Seton does have some tests. There are some other places around that you can check with to make sure. And if you have something else happening, don't delay your personal care. Check with your primary provider, check with Seton, check with some of our other people, but please make sure that you're taking care of yourself, even if it's outside of COVID terms. We want you to be safe and healthy. Jasmine, anything else for us?
Nope, that's it. Thank you guys so much for giving us that information, Dr. Colvin.
Dr. Colvin, thank you so much for being on here with us today.
Awesome. Thanks for having me. Thank you very much.
So that was a lot of great information on what COVID looks like in Bell County. If you have more questions about what that is, where you can get information, those have been dropped into the comments below. As mentioned, the mayor issued a directive mandating face coverings in all commercial businesses. When we get more information and direct links to those, we'll of course share that on our Facebook. We are trying to always be constantly providing the most relevant information. So if you do not already, please follow our Killeen Chamber Facebook and visit our website for more details. If you like these webinars, well, you're in luck. We have a couple of more coming up for you. We actually have one tomorrow on our first business-wise webinar on marketing with Canva. So we're living in a world right now where social media is more important than ever, and we're forced to adapt to creating original content ourselves, and in some cases without a graphic designer. This leaves many businesses scrambling to resources for useful and easy to use things. We love Canva here at the Chamber. It's a great full tool, a free tool, full tool too. And so join us tomorrow at 2 p.m. as Miss Rebecca Moon, the girl you just saw on the screen, create a flyer along with you to show you how easy it is and how cool and helpful it can be to your business. Today's webinar was sponsored by Seton Medical Center. There's a lot of uncertainty right now, but one thing you can be certain about, Seton Medical Center, Harker Heights is still one of the safest places you can be. They've always maintained high standards of safety and infection prevention, and today they're doing even more so their patients feel safe. If you or a loved one needs medical care, especially for an emergency such as chest pain or stroke symptoms, don't wait. Go to Seton Medical Center, Harker Heights, or visit setonharkerheights.net/safety and feel safe in their care. Thank you guys so much for tuning in. Again, if you've watched this, if you're going to watch this when it wasn't live and you have questions, please ask those down below in the comments and we will get them to the right person. And as always, I hope you and your family are safe. Thank you. See you guys tomorrow.